Welcome back. Today is World IVF Day, and with us here now we have Dr. Sandhya Ghode, a noted infertility specialist, obstetrician, and gynecologist who's joining this very special show today. Doctor, welcome to this show. Tell
Thank
us,
you. Thank you for the
Doctor,
invite. Yeah.
we've been talking about IVF and fertility treatments for a long time. But tell us today, why is early fertility assessment so crucial?
The early fertility assessment was not taken seriously in the previous days. Now it has become crucial because of the late marriages, late pregnancy planning, and early detection of the pathologies. People are open up to know what the things are there inside their body. Earlier it was like, okay, pregnancy hua to hua. Otherwise, we can plan it after a year, after 2 years, like that. So because of this, all everything starting the marriage and all after 30 years or 35 years of the age. So things have come into a picture, and because of the awareness, because of the social media awareness, where people want to know how much is the ovarian reserve, how much is the sperm parameters. You don't believe so many people who come to our clinic are unmarried, male and female, who are just curious enough to know what is the picture for their egg, related to their egg, related to the sperm. I see so many college guys coming and just doing the semen sampling. That's a good thing. See, we take it in a negative way, but that is not the one which used to be before. But now we feel ki, yes, that is the awareness where people do have. Like previously also there was no cancer awareness, but nowadays everyone is doing yearly follow-up, yearly checkup, yearly detection of these things. So that means the awareness has put on this way on this.
Excellent. I'm so glad to hear that. And that's why we are doing this day-long special, conclave, digital conclave on the occasion of IVF Day, because awareness is important and to build awareness is very important. Now, doctor, tell us something. How important are general factors in ensuring fertility health? For instance, just listening to your body, maintaining a balance in whatever you do, just don't, overdo Friday nights, or, just maintain a balance, nutrition, healthy eating, exercise, because we're not thinking about fertility all the time. With, we should think about a general a general well-being, but that also goes to build your fertility health. So how important is it to maintain this general well-being, general nutrition, so that when you are actually going in for a family, it's easier for you?
Yeah, that is a good say or good topic I can discuss on because see earlier when we were kids, our parents never used to give us more of the sugary items, sugary candies, fried items and all, as we all know. But the thing is nowadays generation, the demand for that. The way you go for birthday parties, you'll have filled with fatty foods, you'll be filled with candies, with colorful agents and all. And the moment you go for a school, nowadays also in school, I should say to them where they have to maintain all the healthy diet, not to introduce more of these candies, not to introduce more of the fried items or French fries, which has become very famous, and chicken fries, where children opt only that when you tell them to choose a healthy diet in that. So, healthy lifestyle, I believe, begins from the childhood, and that is what it matters. See, the childhood obesity, why the obesity has increased nowadays, why the people way back were not that obese in the ratio, and why it has increased. That is because whatever we had in the childhood, that habit has taken away, and nowadays, because of the trend of being cool enough and going Friday outings, this all things have added up. And boozing regularly every weekly because they feel it is cool, the college guys, and then having smoking and using all sorts of tobaccos, hookahs. See, these all have created a toxic environment around us. Plus, even see, nowadays we see the fruits and vegetables which has come irrespective of the seasonal, all the seasons it is available. That is because of the fertilizer which we use. And in turn, that acts as a toxin to our body because the God has set a particular fruit or particular vegetables to that particular season. But we are not doing that. Because of these all adulteration, our lifestyle, we have to fight against this, and we have to make ourselves fit. How? By doing regular exercise, by avoiding all this junk food and condensed food which will be taking, packed food, and even the processed foods. These all things we have to take in very in moderation. Otherwise, make it zero. If people are, craving for that, take it in moderation, which I believe. And plus, the thing is, taking colorful veggies and fruits and rich with vitamin C's, include more of the healthy oils like olive oil and more of those groundnut oils. And in India, where I can see, we have salads, but the trend of salads have come late. So we should have that in a great portion where we can increase our antioxidants in our body, which will keep our balanced life. And in turn, it will keep our whole of the internal system, including the fertility system, in a balanced way.
Thank you very much, doctor. Very instructive to hear that. And obviously, just go back to being more grounded, more rooted. Don't go by fads. Proper nutrition, proper health equal to, long time fertility. And I'm
And
sure,
exercise is the most important thing. At least 5 days in a week, we have to dedicate ourselves half an hour to 1 hour. We have to dedicate, we have to break our body, and then we have to exercise. That's where it will keep our body disciplined.
excellent. Yes, of course. And, these are things which we keep speaking about, but, we don't really action it always. And as doctor is telling us that, fertility is not something which you start thinking about, when you're in your late 20s or early 30s or trying to start a family, good fertility, good health. Everything starts from childhood. So we should build up to that in a very organized in a mindful manner. Doctor, my last question to you in this segment is that we always talk about the physical aspects of fertility, like you just told us about good diet, exercise, everything. But, healthy body means a healthy mind. So tell us, how do you counsel your patients? How important is mental and emotional well being in the entire process of good fertility, surrounding yourself with a good peer group, maintaining good mental health, or yourself being compassionate and supporting others? How does all this go into making good fertility? Does it not? Tell us a little more about it.
Yeah, when we see this mental health between the couples, okay, I get lots of patients where male dominance is more nowadays in the society. It is there, still there, where the wife become a bit hesitant to talk much on whatever the issues which are going on between them. But we try to extract that history, asking them how is the emotional status of between them in the at home, and how is the background. We just try to scratch that, where few are okay to tell, few are not okay to tell. See, even the husbands also, they are so dominating, then they won't allow the wife to give a history properly, and then they keep few of the histories like settle, like she's on antidepressants or he's on antidepressant, where it will affect the fertility in turn, or he or she must be smoking or consuming alcohol. So even after 2 to 3 times of the repeating, that's where they reveal the history. Even the mental health may, if you ask me, see, the thing is, infertility is a factor where 50% will be from the female factor and 50% will be from a male factor. Where the couples, when they come, many files I see only the female is taking treatment. None of the male investigation was done. Why? Because male feel ki everything is normal, everything is fine. So that's how those taboos we have to remove it. See, most of the couples, most of the husbands do understand, and they willingly come for semen analysis. But few are there where even after repeated 2 months, 3 months of the treatment, they don't accept the semen analysis. That becomes a challenging for us. That's where we do a counseling for them, telling them that both matters a lot. Even one is normal, one may be abnormal, that is okay. See, if being a semen factor being abnormal, or low ovarian reserve, or female having a fibroid uterus, there is something which is not a disease. Infertility is not a disease. It is a condition which is treatable. That's where the patient has to understand. And the point this they understand, that becomes very easier for us to treat them.
Thank you, doctor. It was wonderful speaking to you. And yes, listen to each other in couples, listen to each other, as doctor was saying, listen to your body, take the signals, and listen here to what top athlete Joshna Chinappa has to say about how she maintained good health and overall well-being by just listening to her body more. Listen in.
Well, I've had a couple of knee surgeries, along the way in my career. And the first time when I tore my ACL, it was back when I was 22, and that really gave me the opportunity to understand my body and realize how I needed to train. Because I literally, when you do your surgery, you're starting from scratch. And at that time, I was, going up the rankings, and then this happened, and I had to kind of really sit out of the game. So it really forced me to appreciate my body, train the way I really needed to so that it could complement my game, and especially if I wanted to have a long career, that health had to be the priority. But that was at 22. So when my leg got better and I started playing, I completely punished my body. Like, I was training really hard, and like, of course, a game like squash and singles, you have to be physically incredibly solid to compete with those girls that I was playing with. And everything was great for like 15 years, and I started having another knee problem. And the reason for that was there was no cartilage in my right knee because of the wear and tear of the load I had put on it from sprinting, weight training, all that kind of stuff. And as an athlete, you really, whatever you're feeling, you put into your body, right? Like with training, like if you're dealing with something emotional, you just go back and you work really hard, or like when you have a bad loss, you want to go back and train harder. So things like that. There was no balance when it came to how hard I needed to work, and that kind of took a toll on my body. So in 2023, I had another knee surgery, honestly, just to have quality of life, because I couldn't, get out of bed, I couldn't walk properly, things like that. But then when my surgeon said I could come back to playing, I was like, this time I've got to be a lot smarter with how I train. And so today it's really about enjoying my game, enjoying my body and what it can do, but also being smart so I don't kill myself with, like the physicality of it. I don't play every day. I play 3 times a week today. So of course, and as you get older, post 35, 36, the recovery obviously takes a lot longer. So I'm a lot more aware of, my warm-up, my cool-down, getting the massages, like really the stretching, everything. There's so much more detail today about being an athlete, especially now at the latest stage of my career, like really preserving it so that I can get the best out of, when I get on court. I only play a tournament once every 4 or 5 weeks now, and I make sure that I try to do well in that. But it's just the awareness that you got to listen to your body. Like if something doesn't feel right or you don't feel good, you got to, sit a couple of days out and really, like I said, like just appreciating how awesome the human body is. And if you do the right things with, your nutrition, your sleep, surrounding yourself with the right kind of people, having, working on the mental aspect, the meditation, visualization, breath work, you can still be awesome, but you have to be smart about it.